Hi, everybody. Thanks so much for joining us again. If you're returning after the Casey Means nomination hearing before the Senate Health, Education, Labor, and Pensions, or the HELP Committee, um, wow, it was a pretty event-filled, nomination hearing for Surgeon General. I have to say, I don't think I've ever sat through, I'm not sure that I have sat through entire Surgeon General nomination hearings. I get the feeling that Vivek Murthy's was probably a lot less action-packed. And knowing Vivek Murthy, who is a very thoughtful, not really soft-spoken, but not a big showy guy. I suspect that Vivek Murthy's Surgeon General hearing was probably a much tamer affair than this one. This one was interesting, and Jessica and I are about to unpack that. So let me introduce to my co-host, Jessica Malaty Rivera, and let me introduce myself. I'm Angela Rasmussen. I'm a faculty member of virologist at the University of Saskatchewan. I'm the co-editor-in-chief of the journal Vaccine, and I am on the steering committee for the Save America movement. Jessica Malaty Rivera, my amazing co-host, is an epidemiologist and science communicator whose expertise is really complementary to mine, I think. Jessica understands really well how pathogens spread and also how information spreads within the community. So we're really, I think, pretty complementary hosts, but I'm going to let Jessica take it away and just chat about herself just a little bit.
Yeah, thank you, Angie, for introducing me and for all of you for being here. This was a first for me. I had not watched a Surgeon General nomination hearing in its totality ever before. And it's partially because we've never needed to. I have been in the science communication space for about 20 years and have never felt more needed as far as the work that I do in sense making, trying to translate all of the chaos into meaningful and actionable decisions for people to make informed choices for their health. And unfortunately, we can no longer rely on the federal government and the federal government websites for being places where you're not going to hear pseudoscience. And so that's why we have to pay close attention to these types of hearings, because what we just watched was embarrassing for the United States, for the United States public health infrastructure, for the public health workforce that is part of the federal government, in which this person, Casey Means wellness influencer, is now in consideration for the highest position in that group, and will be tasked with being the nation's communicator. And as a communicator, I take a lot of offense to that because she did a terrible job even communicating simple questions, simple answers to simple questions, many times not even able to say the word yes or the word no.
Jessica, that's a complex topic. That was one of her favorite answers. I'd like to refer to my friend, the NIH director, Jay Bhattacharya, when I say that we need to start thinking about this at a systems level. We need to
Systems,
start thinking about this as bodies
causes.
and humans so that we can find the root causes of diseases that we can't even really fully articulate or define.
Yeah,
This is pretty much how this hearing went today. So for
100%.
everybody who didn't join us for these exciting 3 hours, and actually they were pretty fun. And we were just comparing some of the messages that we were getting, not only
Yeah.
from people who were watching, but also from our colleagues who were watching,
Yes.
which is, for us anyways, kind of the most important part, because it would have been really bad if people were like, oh, great show, guys, like, love it. And then like all of our vaccine colleagues and our public health colleagues were like, you guys were terrible. You guys, we'd rather watch Casey Means without your commentary on the side. But basically what happened was Jessica and I were just sort of, Statler and Waldorf in the balcony, sort of throwing, rotten tomatoes at Casey Means and some of the Republicans as they questioned her and examined her suitability to be the Surgeon General. And as Jessica was just mentioning, I mean, the entire thing was characterized by Casey Means trying to deflect questions that were very specific about her financial conflicts of interest, because she is a very well-paid wellness influencer who, as we were just talking about, is into functional medicine, which is the belief that disease is caused by what they call root causes, which of course exist. But for them, root causes are kind of things that don't really exist or don't at least cause disease. And for Casey Means in particular, she believes that your mitochondria aren't making enough ATP, or the molecule that your cells use for energy. And so she goes off on cellular energy production and da, 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 da. And, you know, it sounds real good unless you're saying it to somebody like me, in which it sounds stupid and completely ridiculous and completely out of touch with any kind of scientific reality. We saw pretty much an example of every type of pseudoscientific deflection there. There was cherry picking, there were straw man arguments, there was just a bunch of mumbo, like pseudoscientific, like sort of babble, like mumbo jumbo jargon. These are the techniques that essentially everybody within the Department of Health and Human Services is using to get these leadership positions, which they will then use to completely destroy health and science in America.
Yes, I mean, I think in keeping with her obsession with whole foods, it was a giant word salad. It was just a bunch of words put together that are dog whistles for the MAHA movement to get people to think that what they're doing is inherently altruistic, inherently science-based, because they sound altruistic and they sound science-based, and they are neither. And that's the problem right now, is that we're just watching a grand deception of the public with the way that MAHA has tried to almost redefine the lexicon that already exists in public health. They're redefining etymologies of disease. They're redefining pathogenesis. They're redefining, treatments and diagnostic tools. They're trying to redefine even informed consent with this idea of shared clinical decision making. All of that is a very intentional and I think incredibly dangerous precedent by the leaders of our public health infrastructure, because they're letting people believe that they're coming in, asking these questions for the first time, presenting data as if it was revolutionary about things like root causes and, mitochondrial dysfunction as being like the actual issue, and deflecting from all the things that they are just sledgehammering. We haven't even talked about the entire time of the hundreds of thousands of dollars, of millions of dollars of research that's been gutted by this administration that is specifically for the purpose of ending chronic diseases, of reducing the harm of infectious diseases, of getting to the, dare I say it, root causes of the health issues in this country. And yet somehow we're coming in and saying we just need people to have whole organic foods, and that's just going to fix it all.
Right. And I mean, I think it's for two reasons. And what people really need to understand about this is not a competing scientific view. This is not an
No.
alternative hypothesis. This is a bunch of bullshit that most people don't disagree with. For example, should we eat better foods? Should we eat fresher
Yes.
foods? Should we eat fewer processed foods? Yes, sure.
Yes.
Like
Who
no
disagrees?
problem. Nobody disagrees with that. Like I literally live off of like processed food and medicine. Like I am like the Food and Drug Administration, big farm, big food, big ags, like poster girl, right? I you know you I would like to eat more fresh food. I just don't have time. Like I'm busy and I don't cook for myself that much anymore. Something I need to work on. But that doesn't mean that I don't like fresh food. Everybody
Right.
literally likes this. And so she comes in and talks about food and nutrition and we need our kids to eat better and all this stuff. And like who's going to disagree with that? Nobody
Right.
disagrees with that.
Right.
And so this is the same thing the MAHA movement does overall. They bring in stuff that nobody disagrees with it, and then they slowly start gaslighting you, and they
Yeah.
gaslight everybody else. And as you said, they define what words mean differently. So
Yeah.
it's actually an Orwellian like remaking
Yes.
of how we actually speak about our own profession. And whereas
Yes.
before, as scientists, when we talk about hypotheses and evidence and testing hypotheses and disproving them or proving them, and then going on to form another hypothesis. This is the scientific method. The reason that this works for so many disciplines is that this method is essentially saying, I have this great idea. Now let's see if it's true. And let's
Yeah.
use evidence rather than just like my opinion or my vibes
Yeah.
or whatever to
Yeah.
make sure that it's true because, I might be biased. I might be in love with my own idea. A
Yeah.
lot of people are in my experience in my field. A lot of people don't like to see their pet hypothesis fail testing. And when that happens, sometimes they decide not to test them. They just start talking about them as if they're already proven fact. And that's
Yes.
exactly what we saw Casey Means do today about almost everything that she was asked about
Yeah, that's right.
vaccines, about public health, about medicine, about everything.
That's right. I mean, you and I are both scientists. I did many, many years in a lab. I have since, put up my pipettes and I'm no longer doing that, but you are very much still in the lab. And you and I both know that science is not black and white. It's an incredibly iterative process. And the whole point is answering questions to things we don't know. We don't live with certainty. Certainty is the antithesis of the scientific process. However, we also know what the totality of evidence can say on things that we have been studying for decades. And so when Casey means a person who is up for the highest position in public health in this country cannot answer a question on whether or not she can say that the flu vaccine reduces the risk of hospitalization and death, saying that she's not seen vaccine effectiveness data, that tells you that she is not living in the reality of the totality of evidence. Instead, she's living in the reality of the talking points of this movement. And this movement is intending to cut holes at even the scientific process. When they're saying things like, the science is not settled, it makes it sound like we are eager scientists trying to come in and just do more science. But what an insult to the people who have been doing this in earnest, whose money is right now, again, getting cut to do this research continuously, and that some things have been determined to be true. Whether or not it is perfectly true is not the question, but we can say that the flu vaccine does reduce the risk of hospitalization and death, that vaccines do not cause autism, because we have proven that time and time again. But these questions are too direct for this type of worldview because what they want to do is continue to lead us into the gray so that they continue their process of bamboozling people into their agenda.
That's right. And she does not want to get in trouble for lying under oath, which is also
Exactly.
why she won't say any of this stuff. You know
Yeah.
what? She would not talk about specific vaccines. I'm so glad you brought up the flu issue.
Yeah.
She wouldn't talk about the specific things she said about influenza vaccines, and she also wouldn't talk about the specific things that she said about the hepatitis B virus vaccine birth dose,
Correct.
which is pretty important because she also said something that I promised to talk about here, and so I'm just going to talk about it right now, that I thought was incredibly interesting and also quite implausible. So she was asked about
Yeah.
a $1.6 million grant that was issued to this group in Denmark without review to do a clinical trial in the country of Guinea-Bissau, Africa, which is one of the poorest countries in the world. It has one of the highest child mortality rates, primarily from malaria. There's
Yep.
essentially no healthcare system there. And this group from Denmark, called the Bandem Project, for the suburb that their clinic is located in, has been doing work there for 40 years and providing a lot of vaccines. Now, that all sounds great, and it is. They have provided a lot of healthcare for the people of Bissau, which is the capital of Guinea-Bissau. However, this study was awarded for this trial where basically they would be comparing the birth dose of hepatitis B virus vaccine to a dose 2 months later. But they weren't looking at how good that vaccine is at preventing hepatitis B. We already know that because we've been using this vaccine for 40 years. It works extremely well and it's very safe. They study something called the non-specific effects of vaccines. And the
Yeah.
non-specific effects of vaccines, according to this group, are basically things that the vaccine does to your immune system that don't target the specific pathogen the vaccine is directed towards. So, if you don't feel well after you get a vaccine, a lot of the reactogenic effects of vaccination are from these non-specific effects. So sometimes this can have beneficial effects. So it triggers all of your antiviral innate responses. You're more resistant to viral infection for a while. You might have fewer viral infections. That's if
Mm-hmm.
you get a good vaccine, according to the non-specific effects people. If you get a
Mm-hmm.
bad vaccine, AKA an inactivated vaccine, then you will have non-specific effects where they don't describe the mechanism, but they claim that in many cases it leads to increased child mortality and specifically child mortality in girls from all causes. So that's not like people who died of malaria or whatever. It's anybody who died, any baby who died, essentially. And, this group has done this study many different times with many different combinations of vaccines, always in this one population, or mostly in this one population. Because when they go into other populations, besides this desperately poor population that has 1 in 5 people chronically infected with hepatitis B, where the number one leading cause of death is malaria, there's no health system. I mean, this is an incredibly vulnerable population, and they are not able to reproduce these results in any other populations. As a scientist, to me, that would say, maybe my hypothesis does not withstand testing. But this group has actually repeated this study, different variations of this study, over and over again for the last 40 years. And there's been a situation, I mentioned that I'm somewhat involved in it. I'm only involved in it because I'm the editor, one of the co-editors in chief of the journal. But another paper was written basically by a different group of somebody who, they were a statistician, and they were pointing out some of the statistical errors in this group's work. And pointing out that it wasn't reproducible, and pointing out that sometimes they don't share all of their data. So this has been a huge topic of discussion in the public health world, because also this grant was given by RFK himself to this Danish woman who is essentially a mentor for all of these people, including people who were mentioned today at the hearing. Tracy Beth Hogue, for example, acting director of the Center for Drug Evaluation and Research at the FDA, an ex officio member of the ACIP, the Advisory Committee on Immunization Practices that convenes 3 times a year at the CDC for the FDA. So Tracy Beth Hogue is a woman who decided to make her college study abroad experience her entire identity, as well as being an anti-vaxxer. She really loves Denmark. She's a dual US-Danish citizen. She's from the US originally. She's all over this, and she's best friends with the PI of that grant that was awarded without review. To make things even worse, that grant was also funded with matching funds from Bill Ackman, the venture capitalist who runs Pershing Square Foundation and is most famous for writing about 6,000 word tweets that are usually about how awesome Donald Trump is, and how awesome RFK Jr. is, and how awesome all of the MAGA world is for billionaires like him who are married to plagiarists. This study's hugely problematic. And so for Casey Means to sit there, obviously she knows Tracy Beth Hogue. Obviously she knows all about this non-specific effects stuff. This is right in her wheelhouse. How much you want to bet she's got non-specific effects that happen to mitochondria? Non-specific effects are real. The question is whether this group's findings are real. They do not seem to be very reproducible by any other group. So I would say that they're at least suspect as a scientist. What she is doing, she's pretending that either there is no doubt when she doesn't want to doubt something. If she doesn't like something, then the science is not settled. And if she's really desperate, I don't know what you're talking about. This is the first I've ever heard of this HPV birth dose study.
That's right. She pretended to not remember a tweet that she posted in September of 2024 in which she called the hepatitis B vaccine at birth a, quote, crime.
Yeah.
I found that tweet, shared the screenshot on Blue Sky earlier during the hearing. That is a direct quote. It was not a mincing of her words or a manipulation of her words. She even made the joke of she'd be a very rich woman, as if she isn't already, about all the times that she's been misquoted by the press. These were her words. She called this vaccine a crime for infants. Now, let's also talk about the absolutely deranged ethics behind how this even happened. There was a really unbelievable article that came out of the Rolling Stone this week that talked about just how it advanced to approval. And I put approval in air quotes because truly it is absolutely mind-boggling that it even advanced in any way. RFK Jr. and Bill Ackman, yes, Bill Ackman, were financially invested in this process. Not to mention the fact that the person who was involved or supposedly involved in the IRB approval, well, he wasn't even there. That person's signature was added after that person had been out of the position for 3 years. This was marked with all kinds of ethical and legal fraud issues. And yet people just kept saying, no, this is going to be the type of study that will be the gold standard to prove to the United States that this is an unnecessary intervention, that what we're doing is, quote, criminal to our babies, and allowing what some people have compared to a Tuskegee-like experiment on Black African babies in Africa. Because again, if it's over there, it doesn't affect us. And that is, again, part of this very deeply isolationist, individualistic, and racist idea of global health, that if issues are happening over there, well, at least they're not happening over here. Not to, forgetting the fact that like global health security is a very much national security issue. This had all kinds of health implications for U.S. citizens, not just the children in Guinea-Bissau. So, I mean, again, when she was asked even about the ethics of it all, she played dumb. And if somebody who is well, she kept holding on to that medical degree, claiming that she had a license, which is inactive. I looked it up on the Oregon registry. It is an inactive license. She kept claiming as a medical doctor, she knows how these things work. She knows how to prescribe medicine. She knows how studies should be designed. How can a medical doctor with a straight face look at this study design or even be told about this study design and comparing which population would be getting a vaccine and which population would be not, and cannot answer the simple question of, is it okay to withhold a safe and effective vaccine from an infant population? The answer is unequivocally no, it is not unethical, and no IRB in the universe would ever approve of this.
Jessica, I don't know anything about that. I'm just a simple medical doctor who's been doing studies in the same population for the last 40 years with my husband, who's been doing it for the same amount of time, basically. And, I just keep doing the same study over and over again. Who was it? Which one was it? Was it Tommy Tuberville or no, it was that other one. Mark Wayne Mullen. Of course, it was Mark Wayne. How could you expect any insights from somebody whose name is literally one word, Mark Wayne? I mean, whatever. Lots of names in the world, but that's a good one. Anyhow, exactly that type of insight I'd expect from that man. The Republicans, every time they come in here and they do this, they don't know about something. They're like, never heard of it. I'd have to look that up. I'll have to get back to you about that. I can remember exactly what I was doing when I inactivated voluntarily my medical license, which is supposedly, I think, Casey's excuse for not having a medical license. And from what I could tell, she doesn't plan to renew it.
No.
No, she was like, basically like, I'm going to be a surgeon general who does not do surgery, doesn't really do any doctor stuff. Yeah. I'm just going to be root causing all over the place. So I don't need a medical license because it's not really medicine.
I mean, it's props to her lawyers and her message training team, because she came in ready with boilerplate statements galore, statements that were intended to appease the Democrats on the committee by saying things like vaccines save lives, which as a communicator is a meaningless sentence at this point. Like, let's be very real about what that means. It doesn't mean anything. It doesn't compel anybody to believe that vaccines save lives.
No.
Also, they don't. Vaccinations do, and there's a distinction.
Yep.
And so it kills me that she would somehow make light of the credentials that are required for this incredibly important job by also just saying, but I graduated from Stanford and I graduated from Stanford Medical School and I did all these things at all these medical schools and I've talked to all these deans of medicine and I've published here and I've published there, but you're not a board certified active licensed provider in this country. And that is breaking years and years of precedent for this role.
I was wondering about all these deans that she's been chatting with. Now, I do work at a university, so I'm aware that there's a multitude of deans at any given university, many of whom I will never meet and most people will never meet. So they could be just like some random person, faculty member. Like, for all I know, Tracy Beth Hogue, when she had an appointment at UC Davis, was like the dean of outside appointments of sports medicine physicians who think that they can write papers about myocarditis in young boys from vaccines. Yeah. I mean, that's like the kind of sort of stretching of the truth that these people routinely do. So I noticed that Casey Means kept saying that she has a decade, 15 years of experience. So let's just do the math here, right? Let's just say that she went to Stanford 4 years for undergraduate, and then she went for another 4 years for medical school. She was not an MD PhD program, so she would have finished med school in 4 years. You don't finish in 4 years, you're out of med school unless something crazy happens. Yeah. So then theoretically, she would have gone on to do an internship, like for like a year or two, I think. And then it would have been a residency, which is usually a few years. And she dropped out right at the end of her residency. So I've got about 13 years there of education, if you include her undergraduate education, which, when I went to Smith and I was 17 years old, I was going to be a doctor. I was going to be a gynecologist. I was going to be an OBGYN surgeon because I wanted to help women. And then I read The Hot Zone and it was all over for me. So cliche. Anyways, so I decided not to go to medical school, which I think was a good move for me anyways.
Same.
But, Casey's acting like she basically started seeing patients on day one at Stanford when, she was probably like trying to figure out where classes were. I mean, it is ludicrous to talk about her as if she's got decades of experience doing this. I mean, I do count my training years. Like when I say I've been a virologist for 25 years, I started graduate school in 2003. So close enough, almost 25 years. I do count the graduate education.
You should.
But
Yes.
that's because like I literally was doing virology from
Right,
day
in a
one
lab.
in graduate school.
Right.
I was not. I worked in a lab as an undergraduate, but I don't really count that when I talk about my relevant virology experience as a professional mid-career associate professor. I talk about things that I've done since I've been a grown-up. I don't put my summer high school jobs in my CV either.
No.
Casey Means is basically taking like everything. It's like I did an internship once and like, so that counts as work experience. Oh, I did. It's like a fellowship. I mean, she's just finding these little things that she's got on her resume and she's basically inflating them into she's some sort of like, I chose to leave allopathic medicine for this energy bullshit because I just couldn't handle being in this status quo system where nobody's allowed to question anything. Whatever. Yeah. She couldn't handle her training program. When I almost dropped out of my PhD program in my 5th year because I was really stressed out too until my mom talked me out of it in a very supportive way. I feel like Casey did that, but she just didn't either have somebody to talk her out of it or she had her mind made up and she wasn't going to do it anymore. But the fact is, like, if you're going to quit, own it. I can't stand people who make these big decisions and then they don't own them and they apologize for them. Own it. You know what? When I call Casey Means a dumbass, demented redhead who's rambling for 2 hours and lying, just like I called Donald Trump the same thing, I mean it. I'm not going to run into Casey Means and have her be like, you said some mean things about me on the internet. And I'm going to be like, I sure did. Would you like to hear some more? Because I have scientific criticisms of Casey Means. I have scientific and moral criticisms. Yes. I have a serious problem with scientists who lie because actually that's scientific misconduct and that should be career-ending scientific misconduct. But second of all, I really have a problem with people who want to sit here and tell me that by me doing my job in the middle of a pandemic and all of my colleagues doing our jobs, doing the best we could, it ruined all of our lives. It was crazy. It disrupted everything. We're all building back now. But you know what? You know what's ruining our lives even worse? These people are doing much worse to our health system and our trust than SARS coronavirus 2 ever could have done. Absolutely. And that is where we are at right now. So I just find it infuriating to have this stupid woman who also has terrible taste in clothing, sit there and say that us doing our jobs is, she's dissenting. She thinks we're not trustworthy because we're not certain of everything like she is. We do experiments because we don't know the answer. She does experiments to show us what the answer is. And that's the difference between me, you, and all of our competent colleagues and the grifters who are currently running our federal government.
It's true. It's true. And look, I'm not here trying to be ageist at all, but I am 4 years older than this woman. And the claims that she makes about all the things she does, just the math is not mathing. Like it doesn't actually make sense for her to have done all these things, especially because, and we know the receipts are there, she dropped out of her 5-year residency. It was a surgical residency for ENT 6 months prior to completion. I have talked to several doctors, and several doctors have actually gone out in media to say how extraordinarily unusual that is, that the circumstances could not have been what she claims they are, which was stress and disillusionment with the U.S. healthcare system. It was incompetence that led to that removal of that program.
I'd say it was incompetence and also opportunity. She realized that
this was a cash cow to go into functional medicine.
Yeah, you make a lot more money than, surgeons make a lot of money, but ENT surgeons make a lot of money. But I mean, who makes a lot more money? Pseudoscience wellness Instagram influencers, which 100%. Is exactly what she is. And now she's 100%. Going to be able to essentially use the entire federal government to monetize her platform, just as so many of her if she's confirmed, future colleagues have already
Right.
done.
And because it is so antithetical to the licensing and board certification requirements of a traditionally trained medical doctor, she didn't have to keep her license active because you don't need to have an active license to be a functional medicine provider. When what she's pivoted to was shilling supplements, providing unnecessary testing and diagnostics, creating a multi billion, I don't know what the valuation of Levels is, but it was a large company.
It was
For
20 million was the original investment, but I don't know how much they've gotten since then, and I don't know how much their revenue is.
Yeah.
Probably a lot. I don't know if it's with a B, but I think
Not
that
sure.
it's
But
doing pretty well, and so is TrueMed.
absolutely. But I mean, I also found it very interesting that she said that she didn't think that every person needed to wear a continuous glucose model or monitor or CGM. But she did say that what did she say? She said that metabolic dysfunction and heart conditions and
Stroke.
something and stroke were like the number one cause of all people's illnesses in this country. And so you don't think everybody should wear one, but everybody needs one is how she kind of framed the sentence. And then we remember from RFK Jr.'s testimony that he said that his goal is to have everybody in America wearing a wearable device.
Yeah.
A wearable device like Casey means Levels, continuous glucose monitoring, which is not indicated for people without diabetes. It has instead, between her and the glucose goddess on Instagram and all of those other platforms, they have completely redefined glucose spikes as if it was something bad. And let's be very clear. If you have a glucose spike, that means that your metabolism is working. It means
Yeah,
your
it means
body's
you ate.
digesting. It means you ate. If you didn't have a glucose spike, that would be concerning.
Yeah.
And I think that what they've done now is just created these false signals to people about what could be bad for your health, including things like a glucose spike, and forced the indication, the non-clinical indication for things like obsessive testing and monitoring, which has caused actual harm. I mean, this goes even into the idea of full body scans, Angie. Like people are over diagnosing, over observing, over collecting data, and it can cause real harm on people.
Yeah.
It's
No,
also an incredibly privileged position to be able to have this type of, disposable income to just set it on fire with all this non-indicated stuff.
well, I think it's just weird. I mean, honestly, do
Also
you like
weird.
going to the doctor like extra times? Like just like the Brian Johnson guy. I mean, this stuff is all weird. And you know what? I think we need to explore this on a future like discussion, but this has the longevity stuff all over it
Yes.
too. I mean, these grifts all come back to be a perfect circle in the Venn diagram at the end.
Yes.
And essentially, if they're into one, they're into another, which is why I don't believe a word she says when she says, I think that vaccines are life-saving and blah, blah, blah. And I think that they're a key part of public health. Okay, what does that mean exactly? You think that one or two vaccines, maybe for some older sick people probably, are okay. But the ones that you just don't have the political sort of capital to get rid of right now, but they'll come for them later. I mean, that's why, and we do have to wrap up here, but Jess and I are going to be having a lot of these conversations, I think, going forward, because we got so much good feedback about it. And I think, I really believe that one of the biggest problems that we are having now is that, the destruction that is being done within the Department of Health and Human Services, that's being done to our healthcare system and that's being done to our science, is going to literally kill millions of people.
Yes.
I'm not exaggerating when I say that. But the problem is that will not happen overnight. They are not going to deschedule the MMR vaccine and the next day, like there's 10,000 more measles cases.
Yeah.
These things take time to build up. And actually, the reason why we have so many measles cases, which Bill Cassidy alluded to at the beginning of the hearing, is that for years now, Kennedy, Casey Means, all of these MAHA people, before they called it MAHA, were doing the same thing. They were decreasing people's confidence in vaccines by saying these exact same lies that Casey Means repeated for 3 hours today.
Yeah.
And that is, I think, the reason why we need to keep having these conversations, because at least, I mean, this is such a ghastly time to be alive and be a scientist, and frankly, to be the co-editor in chief of a journal that's called Vaccine, and a vaccine researcher, and an opinionated one who writes all the time about vaccines. It's just rough, and it's really frustrating that I can see what's happening, like as a professional, and so can you. but the rest of the world can't. And it's hard to figure out how to get people motivated. And I think one way is actually just by talking about it and being kind of interesting and funny and
Yeah.
making fun of these people because they
Yeah.
are clowns. And
Yeah.
that's just kind of what I wanted to end on, is that Casey Means came in and demonstrated herself to be serious about only one thing, and that is taking advantage of the American people and lying to them.
Yeah.
Casey Means is only good at pretending to be something else. She is an actor. She is an operative for the dictator who is trying to crush American democracy at the expense of us and all of our kids' lives.
Yeah.
And to me, that is offensive as a scientist, and it is incredibly offensive as an American, and it is very offensive as a human being. And so, I mean, I'm not a violent person. I'm not suggesting violence, but I'm ready to go to rhetorical war, at least with these people, and scientific war, because I actually know about this stuff. You know about this stuff. Our colleagues know about this stuff. And these people are full of shit. And I think one way we can regain the public's trust is by pointing out to them who's lying to them. So we
right.
get back to all of this as a crime. I can't tell you how many times, and I'm sure you have too, been told, see you at Nuremberg.
More times than I can count.
I just like to see which side of the courtroom I'm going to be sitting on in Nuremberg.
Yeah. I mean, I don't lean into a lot of optimism these days, Angie. I very much live in the doom scroll because it is our job to unfortunately keep up with this fire hose of nonsense, pseudoscience, and attacks on our industry. However, I do want to tell folks watching that there are a bunch of us beyond just the two of us, many, many beyond us, who are committed to fighting, who are committed to being sense makers, who are committed to telling you the truth, providing the receipts and the evidence for it. So if you're not following both of us or the Save America movement, please follow now. Please share this content and include it in your orbits, because this is going to be a very long road to actually restore trust in public health and science. We are watching it being systematically crushed with sledgehammers, but we're not going to let it happen. We have to keep fighting. And so we'll be here to be your navigators. I think right now, as we watch these information ecosystems become incredibly volatile and confusing, our main goal here is to help you understand what is true and what is trustworthy.
I couldn't have finished off this episode or whatever, this hearing. I hope there won't be more episodes of Casey Means hearings. But I couldn't have ended it better myself, Jess. And, I think for the people watching, a couple of things are going to happen now. They didn't vote. Sometimes they vote the same day of the hearing. They didn't vote to advance her out of committee. If they do, that could be tomorrow. It could be a couple weeks from now, whenever. She sat waiting for her committee hearing or her nomination hearing for over a year. So might not happen anytime soon. But eventually they will vote in the help committee to decide whether to advance her to full Senate. And then the full Senate will vote on whether or not she's confirmed if she makes it that far. So in the meantime, please, if you have a senator on the help committee, especially if that person happens to be a Republican, I strongly advise you to call their office as much as possible and tell them to vote no on Casey Means advancing out of this committee. We'll have more information about this as it comes up because, as I said, Jessica and I are planning to do a lot more of this, a lot more communication, and hopefully getting a lot more people talking with us too, because, the Save America movement is not a strictly political movement. It is a citizens committee of people who are coming together because we love our country and we can't stand to see what's happening to it. And we are like the science force that's fighting. And if we want America to be what it is, innovative, it has to have health and science. We have to be able to make things better. And even though things weren't perfect in America, people wanted them to be better. Now people seem to want them to be worse and are actively trying to make them worse. For example, Casey Means. So I think we have a lot more conversation to do, and we have a lot more talking to each other, to our colleagues, and to all of you about these issues. So please reach out. Please follow both of us. Hit those hearts. I've heard that people say this on Substack, but I'm not a Substack person, even though I have a Substack and I'm on it all the time. Anyways, I'm just talking now. So we are going to be doing this again sooner than this, but just to put it on your radar, March 18th and 19th, new meeting of the Advisory Committee on Immunization Practices on the calendar. And boy, that's always a good time. So if you've never looked at my Substack on the topic, pour yourself a glass of wine and have fun. In the words of Lotto, they're clowns and I'm allergic. So, all right, I'm gonna sign off today. I'm gonna thank everybody so much for coming here to listen to this discussion. Really, really, really want to thank the Save America movement. I'm so proud to be a part of it. It feels really good at this time, this horrible time when everything feels bad, to be part of something that's really working for something that I believe in as well. America is all of us across all disciplines. Most importantly, it's our health and well-being. So I'm so happy to do this with you. Thanks a lot to Sam. Thanks to everybody who was watching this. Please reach out. Otherwise, we'll see you at our next one.
We'll see you. Bye, everyone.
Thanks.